I'm Amanda Whittal, Research Coordinator for the Foundation for Alternative and Integrative Medicine. FAIM's goal is to share information about health options with the public through the expertise of over 100 guest writer medical practitioners, as well as international projects to learn and share options for health that are available worldwide. All information can be found on our website at www.faim.org. And as part of this work, we regularly interview practitioners from clinics and health centers that we feel the world should know about. We hope you enjoy today's interview.
Welcome, everyone. I'm here with Dr. Mark Davis, naturopath and international expert on fecal microbiota transplantation, or FMT, and helminthic therapy. Dr. Davis is a frequent author and lecturer, is on the board of Gastroenterology Association of Naturopathic Physicians, and is a gastroenterology professor at Sonoran University of Health Sciences. Mark, Dr. Davis, I'm really happy to have you here today. Thanks for taking the time to speak with us.
So excited to have this conversation.
Really looking forward to hearing what you have to share. Just to start us off, I was wondering if your work takes so many different forms, and do you think you could start by just giving us a general overview of what you focus on in your practice, your teaching, and your research, just to introduce us a bit?
Great. So I've been practicing for a little over a dozen years, and for most of that time, I have focused on patients with gastrointestinal disease in some form or another. I am a fellow of the American Board of Naturopathic Gastroenterology, so I'm one of the very first cohort of naturopathic doctors to achieve that fellowship certification, which I'm very proud of that accomplishment. And so really in my practice, I focus on working with patients with inflammatory bowel disease. I end up working with people with other digestive diagnoses and other non-digestive diagnoses that have to do with where the immune system and the gut interact. So that's my practice. It's all telemedicine since the pandemic. I always did some portion of telemedicine and remote educational consults, but now really since the pandemic, it's been 100%. One of my projects I'm very excited about is working with 3 former residents of mine, providing only naturopathic care for only patients with inflammatory bowel disease in 9 states that we're between the 4 of us were licensed in the US. We're only working with patients in those states, and we're asking patients to keep track of their symptoms every day and to get labs very frequently, every 4 to 6 weeks, so we can keep careful track of what our outcomes are like with them. That's ibdsolution.com as the website if you have any interest in checking out more details of that. So that's what I do in my practice. I have been doing fecal transplant for the entire time I've been practicing. And so I was early on the learning curve 12, 13, 14 years ago when I started to use it with patients. And so I've ended up writing, I mean, I've done thousands of them, and I've ended up writing and lecturing a lot about it and discovering ways that that particular GI microbiome intervention can help people with all sorts of conditions. It's a little bit of an obsession of mine. And in terms of research, most of what I do in a scholarly sense, well, I teach the gastroenterology naturopathic gastro course at Sonoran, but most of what I do in terms of publishing is just taking primary research others have done and summing it up or presenting it in a clinically useful way for peers. So that's most of my writing. But I am the head of the research committee for the Gastroenterology Association of Naturopathic Physicians. So I am one of the lead authors trying to put together a paper assessing the efficacy of naturopathic medicine for patients with IBS, irritable bowel syndrome. So that's a little bit of research I'm involved with. So that's a pretty good summary of what I do.
Amazing. I'm sure it keeps you busy.
Busy, yes, definitely.
But sounds very passionate, and the research is more about naturopathic medicine as a whole for patients with IBS, correct?
That's right. So we have naturopathic doctors, a small group of naturopathic doctors who have a lot of experience treating patients with digestive disorders. And we're just having patients who come to them for IBS keeping track of what their outcomes are like. So not using fecal transplant or helminthic therapy, although occasionally those can be helpful for IBS, but just using whatever is in their toolkit. So that, I guess that's besides FMT and helminthic therapy, another obsession I have is how do we collect data and how do we know what is working and what is not? And so that's what I'm doing in that research with IBS. That's really my focus with IBD Solution, and same things with patients with inflammatory bowel disease. Sometimes we're using fecal transplant, sometimes we're using helminthic therapy, but there's like gajillion other things to do with diet and probiotics and herbs and supplements and lifestyle. And so there's so much to do for those patients. And so those specialty therapies are one thing, but I am obsessed with trying to collect data to figure out what works and what doesn't work.
Amazing. I mean, it's so needed and so important. So I hope I'll definitely share the link with the audience at the end of the interview, just because it's something that I think we're missing a lot, is just getting enough data to show. I think we've got a lot of good experiences about what works and what doesn't, but just having that is such a worthwhile pursuit. So I can understand you're passionate.
Yeah, anecdotes only take you so far, and they're a great place to start. But I think we're as a group of practitioners around the world interested in alternative and integrative medicine. We've been starting to take the next leap into data collection and publishing, and I'm excited to be part of that.
Amazing. It's a great thing to be part of. Well, we wait for some good results. And I think it's such a broad and complex field on its own. So maybe we can just hone in a little bit on the FMT for now, which is, I understand, one of your passions, but still something maybe not new, but something that not all of our audience would have heard about. So can you explain just the basic concept, what it is, how it works?
Yes. So at its essence, the process of doing fecal microbiota transplantation is collecting the stool from healthy screened donors, concentrating the microbial portion of that stool to some degree, and then somehow administering it to the digestive tract of patients with some sort of dysbiosis or microbiome disturbance. And you said it's not new. In fact, it's not new. The first recorded efforts at doing this are 1700 years old in the Chinese medicine literature. And it has been done consistently for that very, very, very long time in those Eastern medicine traditions from China and Korea and Japan. And the first record we have of it coming into modern medicine is in the 1950s here in the United States in Colorado, when there was a bit of a local epidemic of C. diff colitis going around that was killing people. And the story is very interesting. A nurse who was working with these patients asked her neighbor, who was an immigrant from China, who then mentioned these patients who were very, very sick to her own, I think it was her father, who was a Chinese medicine practitioner, who said, well, we could use the yellow dragon soup remedy, which we use only for patients who are the most sick with digestive disease and bad diarrhea and maybe going to die. And so she presented to the doctor she was working with in Colorado, who used FMT enemas for 3 or 4 patients who were really on the edge of death from C. diff colitis, and all of them recovered. And that was the first published record we have in the Western medical literature. So since that time, it has been explored in the literature, and techniques have evolved a little bit. We have some standardized stool banks around the world, and it can be administered via enema, via colonoscopy, via upper endoscopy, or via capsules. Those are the 4 common methods. There are some trials also using little ampules of these dilute fecal microbe solutions in chocolate milk or chocolate soy milk, that type of thing. There've been a couple trials like that. So those are the methods of administering it. And really, I would say the most challenging part for most people is finding a very healthy person without chronic disease of most kinds, who passes the donor screening blood tests and stool tests, has an excellent microbiome to give. That is the hardest part. Once you have a screened donor available to you, I tell people all the time, preparing FMT enemas at home is not rocket science. If you can bake a cake, you can make FMT enemas. Even if your cakes don't turn out that great, you'll be fine. Safely preparing FMT enemas that could be efficacious and could save lives or turn around chronic health conditions. So that's the basics of what FMT is: collecting fecal microbiome from healthy screen donors and giving it to sick people, either orally or rectally.
So you kind of touched on a couple of my next questions. And I guess, though, before I get there, the finding the healthy donor is quite interesting to me. So is it just somebody who has the absence of chronic disease, or do you get situations where somebody seems to be healthy and then they're screened, and actually, I guess, how sensitive is the health of the microbiome that you need?
Well, one of the biggest FMT stool bank that we've had in the world was here in the US in Massachusetts. It was a nonprofit called Open Biome. And I would go to conferences and see their talks, and they would always say, your odds of being selected as a successful FMT donor, passing all the screening tests, it's easier to get into MIT than it is to be an FMT donor. And part of the reason is you can rule out a lot of people just with a health history. For example, being overweight or obese is a rule out. So here in the United States, that's 65 or 70% of people you rule out right then. Anyone with chronic digestive disease, so IBS, very common, that's 5 or 10% of people right there, or any other chronic digestive disease, any kind of autoimmune or hyperinflammatory condition like Hashimoto's thyroiditis, which is very common, multiple sclerosis, rheumatoid arthritis, anything like that. Any mood disorders like generalized anxiety disorders or major depressive disorders. And that is not like just a fringe alternative or integrative medicine opinion. This is all the conventional medical doctors who are involved with FMT are like, no, there's too much of a connection between the gut microbiome and mood disorders for us to feel comfortable using donors who have mood disorders. So that, honestly, I see that rule out a lot of people. So really health history is doing most of the rule out. And then we run blood tests, usually just HIV, syphilis, and viral hepatitis, because there are microscopic amounts of blood shed in stool in perfectly healthy people. And so some of those blood transmissible conditions we screen for. And then we look at stool. We're looking for C. diff. We're looking for ova and parasites. We're doing a stool culture. And then we're looking for genes for antibiotic resistance. There has been, and I think we should talk more at length about safety later in the interview, but I just want to start now by saying there's been really one death that was very clearly associated with FMT. Not actually caused by FMT, I would say, but FMT was a contributory factor. And here was the story. This was, I believe, a 78-year-old male who had blood cancer and was undergoing bone marrow transplant. So that is about as immunocompromised as it gets. And one of the niche uses of FMT is to treat something called graft versus host disease. That's when somebody gets a donor tissue transplant, and the immune system of the graft, of the transplant, starts attacking the host. Graft versus host disease. And some small clinical trials demonstrated that FMT could reverse or treat graft versus host disease in some cases. So someone had the good idea, let's see if FMT could prevent graft versus host disease. So this gentleman was in that clinical trial, very, very immunocompromised, and did acquire an antibiotic resistance gene. Then later, not because of FMT, got pneumonia, but the pneumonia bugs, those bacteria, through horizontal gene transfer, had acquired antibiotic resistance from FMT. And so that pneumonia ended up being antibiotic resistant, and they weren't able to treat it, and he did pass away during that clinical trial. So, so for a long time, we looked at the literature and did meta-analyses and said FMT appears to be safe for immunocompromised people, people with HIV/AIDS, people on biologics, people on high dose of steroids, people who have undergone solid organ transplants. All these very immunocompromised people, the literature made it look safe, but this clinical trial made us say we've got to screen everybody for antibiotic resistance genes, so we do screen bacteria in stool for those as well. So we screen them, and I would say that is a rule out for people who pass all the health history tests that I see. And the second most common one has got to be protozoans. So when we run an ova and parasites test, we'll find Blastocystis hominis or Dientamoeba fragilis or something like that, Entamoeba histolytica. So that can be a rule out. And the third most common rule out in my experience is C. diff. About 5% of healthy asymptomatic adults are carrying detectable amounts of toxin-producing C. diff, and it's okay for them. We don't necessarily need to treat it. The rest of their microbiome is keeping it in check, but we fear that that can be really dangerous in somebody who already has colon dysbiosis. So those are the screening tests that we do. And for your listeners, if you want, I'll send you a link and a password for a form I put together if they're interested in screening their patients that has all the health history questions and the labs to order, and if they're in the United States, ICD-10 codes to get insurance to cover it.
That would be fantastic. Thank you.
Sure thing.
Quite the screening process.
Yes.
And so even with those slim chances of getting someone who is a healthy donor, you do still do quite a lot of these. So I guess there are a subset of healthy donors that you do manage to get, and you do manage to actually perform the FMT procedure. And I suppose you kind of answered my question, but basically people can do it at home. So my original wonder was how easy it is of a process for people to undergo. It sounds pretty easy, but you've got different methods. So you've got the capsules, you've got the enemas, you've got infusions. So how do you decide? Are all of them relatively easy to undergo?
So the enemas are very, very straightforward to do. And for a long time, I also thought they were safer because what you're doing is you're taking fecal microbes from the donor that are coming from the colon and the rectum, and you are using an enema to administer those to the colon and rectum of the sick person. So you're taking one set of microbes from a compartment and you're putting them into the same compartment as the donor. The small bowel microbiome is very, very different than the large bowel microbiome. So when you're administering FMT through upper endoscopy or even through capsules, you are getting some large bowel microbes in the small bowel. And for a long time, I would only use capsules or recommend upper endoscopy administered FMT for patients with Crohn's disease that was in the small bowel or other conditions where I felt very convinced that the small bowel microbiome was involved, because I was concerned about the safety that maybe we could be giving people small intestine bacterial overgrowth or other things. And then 3 or 4 years ago, a Chinese group, and actually there's a guy named doctor named Fameng Zhang in China who's published probably more about FMT than anyone else. They have a very, very robust research group. Anyway, and their group published a small trial of giving upper GI FMT through upper endoscopy to a set of patients with irritable bowel syndrome and small intestinal bacterial overgrowth. And it was actually very helpful to that group, not harmful at all. So I had to change my tune and say, reality always trumps theory, and I had a theoretical concern, but here we have clinical results showing that it's not dangerous, and in fact, it is helpful. So since that time, I've been more comfortable giving upper GI administered FMT to a larger subset of patients.
Okay. Oh, okay, that's fascinating. I think probably many people would have had the same concern just by pure logic, but this is quite interesting. It just shows how many different aspects of the microbiome and the small intestine, large intestine we don't necessarily know 100%.
Yes, absolutely.
So now do you favor one method over the other, or does it really depend on the subset of patients?
It does depend on the subset of patients, what the diagnosis is, where the pathology is. So for patients with ulcerative colitis or ulcerative proctitis or even irritable bowel syndrome, I tend to recommend starting with enemas. There are some exceptions to that. I'll have patients who are having bowel movements 20 times a day, 30, 40 times a day. And for those patients, holding 4 ounces, about 120, 150 milliliters of fluid in their rectum for 4 or more hours is impossible if they're having diarrhea that many times per day, even if we're giving them some loperamide or other things to try and help them keep it in there longer. So for those patients, I will absolutely move to capsules. Other patients are socially or emotionally or psychologically uncomfortable with rectal therapies. They have fearfulness. They don't want the discomfort or pain. And so just for those reasons, we'll move to capsules. Other patients, like I have had patients who are physically unable to reach around and administer an FMT enema to themselves, and they are unable to travel to see a clinician, and they don't have someone in their lives who can administer it to them. Sometimes people who are more morbidly obese or have advanced arthritis in their hands or other things can prevent that from being feasible. And in that case, capsules is a good choice. I will say, preparing enemas is easier than baking a cake. It's very, very easy. Preparing capsules is a little different. There are some people who will just take donor stool and put it inside an empty capsule and then over encapsulate it a couple times sometimes and use those. And I've read stories on chat groups of that being helpful or it not being helpful. But anecdotes can only take you so far. And in the literature, all the capsules that have been prepared are prepared a different way, where you take a centrifuge. Now, this isn't just any centrifuge that you can pay $100 for to spin down blood or whatever. This has to be a large volume, high speed centrifuge that costs about $5,000 or $6,000 here in the United States. And so there's a bit more of an expense. I've had probably 10 people in the past decade, patients, choose to spend the money on a centrifuge to prepare it at home. Originally, it was all medical doctor parents with kids with Crohn's disease or ulcerative colitis because they could master the learning curve and they had the money available to them. But since then, I had a filmmaker, I had a stay-at-home parent, I've had other people who just said, yeah, I can master that learning curve, and that's within my healthcare budget. But so you have to spin it and then dispose of the pellet part and respin the supernatant and then dispose of the new supernatant and keep the bacterial pellet and liquefy a little bit, add some cryopreservant, then pipette it into small capsules, which you over-encapsulate once and then over-encapsulate a second time. So it is manageable, it is doable, but it is a bit more of a learning curve and there's certainly more expense associated with it. Yeah. And so pretty much over the past decade plus that I've been working with FMT, when I recommend capsules, I'm telling people about this method that I'm familiar with in my clinical practice and that's there in the literature. So that's harder to prepare. But then there are a bunch of clinics around the world that prepare capsules as well. It's pretty expensive, but for people who don't want to deal with the learning curve, they can travel to places in the world that offer it and get capsules if that's what's indicated for them.
Okay. Interesting. It's kind of amazing to me how much people can actually do on their own at home if they want to, or if they're willing to go through the learning curve. So that's
absolutely.
It could ask you a million questions on that, but actually I have a couple of other ones.
Well, let me pause there and just say that the link I'm going to give you to share with listeners actually has, so it has a donor screening form, and then it has a DIY FMT guide that clinicians can use with their patients to say, here is a step-by-step guide to do this at home. Here's the equipment you need to buy. Here's how you need to prepare. Here's how you have the donor collect. Here's how you self-administer it. So I really, I have colleagues and good friends who say, no, this should only be done in a medical practice or in a clinical trial. And I firmly and respectfully disagree. I think this can be done safely, effectively at home by people with carefully screened donors following careful instructions. And so I'm a big advocate for that.
Okay, amazing. Yeah, I think a lot of patient empowerment is really important to be able to get these things done faster, more efficiently. So fully respect that approach, and thank you for sharing the materials. I think that's really, really useful for people.
Great.
And just, I suppose you've touched on a bit of this, but in terms of people who could benefit most from it, it sounds like it's a pretty, digestive disorders are obviously the key clear one, but it sounds like there are a lot of other applications for FMT. Is there a top few that you would say it's useful for, or is that narrowing it down too much?
No, I think that's great. So I will just touch on the digestive things real quick. So the silver bullet is for C. diff colitis. Okay. C. diff colitis kills more people than HIV/AIDS in the United States every year. And it really is a scourge and getting worse over time in terms of frequency and virulence. So C. diff is a major threat, and it's becoming more and more antibiotic resistant. We have antibiotics, metronidazole, vancomycin, and fidaxomicin, that can actually durably cure over 50% of people. But there's a substantial majority that either are not cured or brought to clinical remission in the first place, or quickly relapse afterwards. And for those patients, over 90% of the time, FMT is able to cure them with a very, very low relapse rate. So it's an amazing intervention, very, very, very safe for that indication. The second most studied indication is for ulcerative colitis. And if you compare efficacy rates versus placebo, FMT is as effective as any of our ongoing monthly $10,000 to $20,000 a month biologic drugs that are usually given intravenously, often intramuscularly, or there are some oral biologic and small molecule drugs. But it is about as effective at inducing clinical remission and deep remission as any of those indications, and can be very easy, very fast, and very, very cheap. So I'm a big fan of it for ulcerative colitis. Crohn's disease has been studied less, so we have less evidence, but the smaller amount of evidence we do have indicates it's probably even more effective for Crohn's disease than it is for ulcerative colitis, and that's my clinical experience as well. Those two indications, inflammatory bowel disease, only about 0.5% of people have those, but 10 times that number, 5% of people at least have irritable bowel syndrome. Much less, it's not lethal, which inflammatory bowel disease can be, but much more common and can really decrease quality of life. There is a pretty robust amount of literature on FMT for IBS, and it's a little contradictory. There have been negative trials and positive trials, but if you look at the meta-analyses, indicate that the positive trials outweigh the negative trials, and there is indeed clinical utility in using it for people with IBS. I call IBS 100 things with one name, and so it's not the first place I usually go for my IBS patients. I'm working with diet and probiotics and herb and other things, but I will use FMT sometimes in recalcitrant cases, and it can be very effective. The next most interesting category of things it's used for, can be used for, I think, is neurodegenerative conditions. So there is some interesting evidence for multiple sclerosis. There's some anecdotal evidence for Parkinson's. Those are the big two. One quick note, I will say that my clinical experience so far, I've worked with 4 patients with ALS, Lou Gehrig's disease, amyotrophic lateral sclerosis, and unfortunately, none of them benefited at all from FMT as far as we could tell. They were all pretty advanced cases. Maybe we could consider earlier cases, but no benefits so far that we've seen there. Another neurological disorder, autism spectrum disorder. There are at least two published trials, one that is completed, I'm not sure if it's published yet, and one that is ongoing, which shows statistically significant benefits on not only digestive health in patients with autism, but also neurological health. Substantial benefits that last, that happen quickly, and then at 2-year follow-up are still present or even better than they were initially. So that's an exciting one. And then I guess I would say I would consider using FMT because it is so safe for anybody with any autoimmune or hyperinflammatory condition, because it's affecting the microbiome and the immune system's relationship with the microbiome. So I mentioned graft versus host disease, also alopecia. It's been studied for alopecia, and there are fascinating studies and photos of hair regrowth following FMT. So I guess that's where the most robust evidence is, and there are another handful of things I could talk about, but the evidence is a lot more sparse for those. But the umbrella covering those is anything autoimmune or hyperinflammatory.
Okay. Wow, I have to say it was much wider spectrum than I expected, and it's Pretty exciting. I mean, I know there's more and more research coming out on the microbiome and just how many things it's linked to in our health. So I think this is a really great example. Neurodegenerative disease is a fascinating one in terms of it's a hard one to unlock and to deal with. So looking forward to more trials on that.
Yeah, same.
Mark, I know we've got about 10 minutes left, just under 10 minutes. So there are a couple other things I wanted to touch on, but I can give you the option based on what you think is most important to share with our audience.
Great.
I think you touched on the safety of FMT pretty sufficiently, but I don't know if there was anything else you wanted to mention that's important.
Just that it is safer than most drugs that I prescribe and is safer than many herbs that I prescribe. It can put a small subset of patients with inflammatory bowel disease into flares. But besides that, any severe adverse events are very, very rare. The only common adverse event we see is 5 or 10 days of bloating and sometimes changes in stool consistency that pretty much 100% self-resolve. So very, very safe, a big proponent of it for that reason.
Really exciting. I think more people should know about it. Great to hear. And I guess the last one, I would like if you could touch on what helminthic therapy just to give people an insight. But before we do that, is there any last consideration for FMT that people should know? At the end, we'll get maybe just you to give your contact information if you want to, but any last kind of takeaways?
I will throw out one more because we met at the ICNM conference where I was lecturing on FMT for the use of hepatic and central nervous system disorders associated with alcohol use disorders. And I had to lecture on that because it blew my mind about how robust the evidence is. Severe alcoholic hepatitis has a pretty high mortality rate. And now there are 3, 4, 5, probably 6 or 7 randomized controlled trials of FMT, well, standard of care plus FMT versus only standard of care, showing dramatically increased survival rates, decreased rates of hepatic encephalopathy, and all the side effects you expect. So you really can, there's a huge microbiome component with alcohol use disorders and addiction and craving and liver problems and central nervous system problems. So, and FMT can make a massively robust difference. So I just want to throw that out one.
Amazing. Thank you for including that one, actually, because it was a fantastic lecture and really exciting to hear. So I think there's some publications that people can read, correct?
Absolutely. Quite a few. I'll send you those trials too, if you're interested.
That would be great. Thank you. I mean, so much to talk about. I think we could have had a longer interview, but just in the last little while, do you mind giving a kind of 2-minute summary, and then we can add a little bit of a information blurb for people who want more information, just on your other passion.
Yeah.
And we'd like to leave a couple minutes to just wrap up with your contact.
Yeah, perfect. So helminths are microscopic worm-like organisms that natively live in the gut of every type of vertebrate on the planet. So every type of fish, every type of bird, every type of mammal on the planet has microscopic worm-like organisms that natively live in their gut. And that counts humans. When you look at modern-day hunter-gatherer communities of humans in certain places around the world, the Chimane in Bolivia and other parts of South America, hunter-gatherer communities in the south part of Africa, somewhere from 20 to 80% of any given community, usually hovering in the 40 to 60% range, have helminths living in their gut. And there are thousands of species. Some of them cause a lot of harm to the liver, harm to the kidneys, harm to the brain, harm to the vasculature is what causes elephantiasis. So there are bad guy helminths. There are some that have only very, very benign adverse effects. And what they all have in common, the bad ones and the not so bad ones, is they evade being destroyed by our immune system by increasing tolerance. So it seems over the hundreds of thousands of years that the human immune system has evolved with helminths being in our guts about half the time. Some of us have ended up evolving genes that can't put on the brakes of our immune systems quite as well without helminths in the gut. So for some people with autoimmune and hyperinflammatory conditions, we reintroduce helminths to the gut microbiome. There's 4 that are out of the hundreds of thousands of species that affect all sorts of mammals. There are 4 that we use commonly because they're so safe. My favorite is Necator americanus, the New World human hookworm that's administered dermally. The other 3 are administered orally. It's human whipworms, pig whipworms, and then a very tiny tapeworm that spends its life going back and forth between rodents and beetles. All of those are available commercially around the world from different providers. And when you give helminths, there are some adverse effects. You get an itch for 24 to 48 hours when you use the dermal one. 3 to 6 weeks later, you get what's called the worm flu, which is usually about a week of nausea and abdominal discomfort. And you do have to wait a while. I tell people we're usually waiting 6 months before we can anticipate seeing clinical benefit, but then we can see massive clinical benefits. I've used this mostly in my patients with inflammatory bowel disease, but the most exciting literature and some of my most exciting cases were for patients with celiac disease. There have been 3 published trials of helminths for celiac disease. Nothing else in this world has even had a glimmer of hope, really, at inducing immune tolerance to gluten for people who have celiac. But the second trial that was published showed 8 out of 11 people eating literally a bowl of spaghetti a day, people with biopsy-proven celiac disease, with no increase in blood biomarkers, quality of life remained good, biopsies looked normal. A later trial made things look messier and more confusing. Life and medicine can be messy and confusing, but I've used helminthic therapy, specifically Nicator americanus, with 3 patients with celiac, all of whom really improved. 2 of them did not want to introduce gluten. They're like, I've realized that is not my friend. But they just decreased hyperinflammatory processes in other ways. The third was a guy with celiac disease and ankylosing spondylitis. He's having about 4 flares of AS per year, very debilitating. And any hint of gluten would bring one on. It's been about 8 years, and he still to this day periodically re-inoculates with helminths, eats gluten whenever he wants, has sandwiches and beers, has not had a flare of ankylosing spondylitis in 8 years or however long it's been. So that's a great, very exciting case, and can help with other autoimmune things as well.
Fantastic. It's a very interesting one. It's one, to be honest, I hadn't heard of before. So I think what we'll do is try to provide people with maybe some links as well to learn a little bit more about it in detail. But in general, Dr. Mark Davis, I think everything you're doing is totally fascinating. And is there any information you want to leave people with in terms of where they can learn more, where they could reach you if they had questions or wanted to get in touch?
Yeah, so I love speaking with other clinicians about these things, and I meet with them. I don't charge any money, and I just love to share information so they have these tools available to them. And they can reach out to me at Mark, M-A-R-K, at ibdsolution.com, or anyone who's interested in scheduling an appointment in one of the 9 states where you can see on ibdsolution.com. Myself and my former residents are licensed. That's support at ibdsolution.com, or if I do remote educational consults about FMT and other things in other states and countries as well. So again, for an appointment, that's support at ibdsolution.com.
Fantastic. Thank you so much again for taking the time. I'm sure our audience is going to be thrilled to learn some of this, and hope to speak to you again sometime.
Such a pleasure. Yes, thank you for inviting me.
Thanks, Mark. Take care.